Hi, and welcome to 3 o'clock with SOC. I'm Marisol Diaz, Communications and Digital Manager. Give me a moment while I welcome our Spanish-speaking residents. Buenas tardes, gracias por estar con nosotros hoy en 3 en punto con SOC. Si quieren oír este programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122, y la contraseña para entrar es 779-328-221. And just a reminder that you can access this show and previous shows on our Facebook page in the videos area and on YouTube. Now I'll pass it over to our moderator of the day, who will introduce today's topic.
Hi, everyone. My name is Marlene Zaron. I am the COVID-19 project coordinator and the forum coordinator here at the Southside Organizing Center. Welcome to 3 o'clock with SOC today. And I just want to say that the staff and our platforms are available to everyone that needs to utilize them during this time. You can call SOC at 414-672-8090. You can also email us at soc@socmilwaukee.org, or you can check out our website at www.socmilwaukee.org. On our website, we have all updated census, COVID-19, and CIVIC information for you. So that being said, I want everyone to take the time to complete our SOC survey. Essentially, our SOC survey allows us to get more info on different topics that you want us to talk about on the forum, or any topics that we haven't covered, anything that you'd like us to fix in the forum, or any suggestions that you would have. We love to get your feedback, and we love to see who our audience is and who's engaged. So that being said, I'm currently working from home, so that is why I am not wearing a mask. But if I were to be at work, I would be wearing a mask. Just want to give that information out there to the audience. SOC is very adamant about following COVID-19 regulations. So I just want to take the time to, ask the viewers and the audience to give us a quick hello, tell us who's here. We love to know who our viewers are, even if it's a quick emoji, put it in the comments. And we want to see you all engaged. And if you have any questions throughout the forum, please feel free to post those in there. A disclaimer that the views and opinions shared today do not necessarily reflect those of SOC. And now I'm going to go into our announcements. So today is the COVID-19 day. Every Thursday, we cover all topics COVID-19 related. Our feature segment today is going to cover opioid overdose increasing in Wisconsin since the pandemic began. Our main guest is going to be Paul Krupski. He's from the Department of Health Services. He's the director of Opioid Initiatives. So we're going to get a really nice viewpoint from him and a perspective on what's been happening with opioid increasing in Wisconsin. Just a quick review of the rest of the week. So tomorrow we're going to have Dr. Joseph, Dr. Baez, and Jennifer Morales to talk about the MPS school board and what's happening with that right now. And now I'm going to introduce Paul Krupski. Again, he's the director of Opioid Initiatives in Wisconsin. Hi, Paul.
Good afternoon. How are you?
Great. We're really grateful that you're here with us today. We know this is a really important issue to cover in Wisconsin, and we love to get just more information, and for our audience to get the basics, of what opioid overdose is, what different types of opioids are, how that's increased in Wisconsin, and how that the pandemic has been a huge contributor to that.
I appreciate the opportunity. Thanks for having me.
Of course. So I'd like for you to kind of give us an overview of yourself and your background, what your role is with the Wisconsin Wisconsin Department of Health. Exactly what is it you do?
Sure. So as you mentioned, I'm the director of Opioid Initiatives at the Wisconsin Department of Health Services. And in describing my role, I kind of like to put it in three buckets. My primary responsibility is to coordinate all of the department's efforts to combat the opioid crisis here in Wisconsin, which there are many. We have a lot of different moving parts, a lot of different programs and services that the department supports statewide. So really coordinating all of those, making sure that we're moving as seamlessly as possible, that we're not duplicating any efforts, so on and so forth. The second bucket is that while the Department of Health Services is really the primary department in response to the opioid crisis, all of our other sister state agencies play a role as well. So, we talk a lot about how the opioid crisis really impacts everybody, whether you recognize it or not. And that goes the same, and that goes the same way with the response needed to combat that. All of our sister agencies play a role as well. So I regularly am in communication with, as an example, our State Department of Justice, Department of Corrections, Department of Children and Families, to make sure that I'm aware and informed of the efforts that they have going on, so that, again, we can be supporting each other, streamlining those efforts, and then also that we have the opportunity to collaborate when possible. If there's a project that they're working on that might be overlapping to an area that we address, we want to make sure that we're working together and really creating the biggest impact possible in those areas. And then the third bucket is it's really my responsibility to be that contact for the people of Wisconsin, for all of our partners and organizations statewide that are delivering services, that are providing the needed care to individuals who need it. So it's my job to be in contact with them. Have my thumb on the pulse of what is happening in Wisconsin, understand where there may be some challenges or barriers, and really determining if there's something we can do at the state level to address those so that we can be providing even higher quality and better services.
Wow, thank you for that description. Sounds like you have your role in place and you really know exactly what's going on with opioid addiction, or essentially it's an epidemic at this point, especially in the United States. Mm-hmm. So that being said, can you give us some statistics on numbers of opioid overdoses happening in Wisconsin and Milwaukee?
Sure. So unfortunately, I'm guessing most people that might be participating today are aware that we have seen a spike in opioid-related overdoses here in Wisconsin during the pandemic. And this is nothing that is unique to Wisconsin. It's an unfortunate trend that is taking place nationwide. But at the department, we have done our best to make sure that we are bringing awareness to this, that we are heightening the issue, and then that we are making people aware of those kind of supports that are available to them during this time, which I know we'll talk about a little bit more later. But specifically, some statistics I can share with you is that statewide in Wisconsin in 2019, there were 2,743 opioid-related overdoses. In 2020, we're already at 2,990. So we've already exceeded that number with a few months still to go. In Milwaukee specifically, in 2019, there were 941 opioid-related overdoses. And in 2020, there's been 923. So again, with a few months left to go, very likely to unfortunately exceed that number in Milwaukee County this year compared to last. As I mentioned, the opioid crisis really does affect everybody in all demographics, but specifically in Milwaukee, year to date, we have already seen an increase in some demographic areas. Specifically, we have seen more overdoses already in males. We've seen more overdoses in the age group of 45 to 54-year-olds. And we have also seen an increase in overdoses in African Americans and also Hispanics. So there are also many other demographic areas for Milwaukee that will likely exceed the 2019 level as we finish out this year in the last couple months, which again, is trending in the wrong direction and not what we want to see. But we're trying to, again, make sure that people are aware of this and that aware of the services and treatment that are available to individuals that might be struggling with substance use.
Thank you for that explanation. For those of you watching, a lot of you might not even know what opioids are. So before we dive deep into all the criticals, can you explain what opioid is for those that are not aware?
Sure. So at a very high level, opioids are substances that interact with the body's central nervous system. And what they do is they dull senses and reduce pain. Again, at a very general high level, there are different types of opioids. Some that are natural derivatives from the poppy seed plant, such as morphine, which some might be familiar with. And then you have your semi-synthetics or synthetic opioids, which most people are much more familiar with. So your prescription drugs, such as oxycodone or hydrocodone, and then on the synthetic side, fentanyl as well too. So that's a kind of just very high general overview, but no matter the type of opioid, what they're really doing is that they're dulling senses and reducing pain, attaching to those receptors in the brain and impacting the body's central nervous system.
Wow, so that's definitely a way for individuals to kind of overuse those types of drugs to kind of alleviate any mental health distress that they're currently having, especially during the pandemic right now. Quickly, so how do individuals get access to opioids? What's the most common way?
So the most common way that somebody would access the opioids would be through prescription, through a doctor, based off a diagnosis that they have, and then what would be if that's the best form of care for the individual based off what that diagnosis is. So kind of through that prescription drug realm is how most people would access opioids. But then of course we have the illicit side of it too. So individuals that are accessing drugs such as heroin, or unfortunately what we're seeing right now with the rise in synthetic fentanyl is that pretty much any illicit substance that you can think of, so cocaine, marijuana, methamphetamine, these are all being cut or laced with the synthetic fentanyl to increase the impact that they have, or the strength of the drug, basically trying to create a better high for the individual. So that's the other way that individuals would obviously access those type of opioids, would be on the illicit side of the black market kind of side of things.
I recall I used to work in the emergency department as a scribe, and doctors would essentially keep track of patients. So I recall there was a patient that was trying to get opioids due to their back pain, but the doctors checked on their previous history, and they've gone to multiple hospitals over the past few weeks trying to get opioid prescriptions from multiple doctors at the same time, and they go into different types of locations, which is a part of addiction. Like individuals will go to ultimate lengths to get this drug.
Yes, that when somebody is struggling with addiction, you're right. They're going to and a lot of times do anything necessary to obtain the substance that they're using, and specifically with prescription drugs, the tool that you're referencing is the prescription drug monitoring program. That and actually in Wisconsin, both physicians and pharmacists are required to check the prescription drug monitoring program, where they are then able to see exactly what you described. What types of prescriptions has this person been given? Who provided it to them? What are they currently taking? And that is really cut down and helped address that kind of the issue on the prescription drug side of things, preventing people from obtaining more prescriptions than necessary, doctor shopping, like you kind of mentioned before. So that's been really helpful. Not that prescription drugs still aren't a challenge, but much more of the issue that we see around use when it comes to overdoses and deaths is really on that heroin or synthetic fentanyl side of things than it was prescription drugs, maybe say, 5-10 years ago.
Right. So now that we're talking about the whole pandemic and how it's been affecting everyone's lives. Can you talk about why do you believe there has been an increase in opioids and opioid overdoses since COVID-19 began?
Yeah, so unfortunately, as we already talked about, overdoses are on the rise during the pandemic nationally. And it's well documented that during the pandemic, it has led to increased levels of stress, anxiety, isolation. And so these factors don't bode well, really, when we're talking about substance use, unfortunately. When individuals are struggling with stress or anxiety, levels they may have never experienced before, as well as other issues that may be causing this. So family issues, employment issues, housing, financial issues. If individuals aren't finding those safe and healthy coping mechanisms to deal with these challenges that they're experiencing, unfortunately, some are going to turn to substance use. So the other issue is that individuals might just they might believe or have the understanding right now that help isn't available because of the pandemic. A lot of what we see is that everything's shut down. It's not open. We don't have this, and that's not true. That is something that the department has really tried to, again, bring awareness to and heighten during this pandemic, is that services are available to you right now, and individuals that need help should reach out. So we need to be making sure that we're connecting individuals to the services that they need during this pandemic. So whether that is getting help through helplines or hotlines, virtual support meetings, or that behavioral health treatment and care, or obviously substance use disorder treatment as well. That's really what we're trying to make sure that people know they can access during the pandemic.
Of course. So that makes a lot of sense. So how can someone recognize the behaviors of individuals who are addicted to opioids?
Yeah, that's a great question, because we have to know what to look for, right? To be able to help someone sometimes if it's something we're not familiar with. So there are many behaviors that are going to be to look for that are going to be general to just substance use, but there are some that are specific to opioids. So some of those things to look for are someone who's maybe finishing their prescriptions early, or taking more of their prescription than they're prescribed to take. As you already mentioned when we were talking earlier, visiting more than one doctor, and not just maybe visiting more than one doctor, but and obviously for a prescription. Not many people visit more than one doctor if they need to see a specialist or something. But are they visiting more than one doctor for a prescription? And then is someone driving a good distance to visit that? If somebody is your friend or family member in Milwaukee driving up to Green Bay to see a doctor, that could be a sign. Changes in sleeping and eating habits, as well as just mood swings, are something that you could look for. Slurring words, constricted pupils, or what's referred to as nodding off. So a lot of times, because it's a depressant, because of the impact it'll have on people, is their eyes will close and their head might drop like this. That's something to look for, is referred to as kind of nodding off. And then also stealing, and this could be not just stealing money, but it could be stealing valuables to sell for money that's needed to obtain the drugs, or excuse me, it could be stealing medications themselves for somebody who is struggling with substance use.
Great, yeah. For those of you that do have family members and friends that are currently affected by opioid, our solidarity goes out to you guys. So that being said, you know, how can a family member or friend interject on something like this? How can they try to convince the individual to seek care? Because that's a huge issue, and in Wisconsin and other states in the United States, you know, it's their right to accept the fact that they have a problem and go seek care, so on their own. So how can, you know, if a family is seeing their like child is going through some type of drug addiction, what do you feel are the steps that someone can take? You know, what are the what are the steps?
Yeah, so sometimes it can be really difficult and a challenge, because you know someone just really has the other person's best interest at heart, right? And we want to get them the help that they need. But when supporting a loved one or a friend, it can be difficult. But you have to remember that everybody is not going to be ready for treatment at that time. It's really about meeting somebody where they're at. So we have to meet people where they're at, and while treatment might be the ultimate goal that we're trying to get the person to receive that care, we can't get someone to treatment if they aren't alive. And so that's why we really have to think about harm reduction strategies that can help someone until they're ready for treatment. So this could be something like syringe access services. So, if they're an injection drug user, making sure that they know how to get clean needles and get the care and services that they're needed that way. Getting the individual trained and obtaining naloxone, which is the opioid reversal drug. And we really encourage not just the person using substances themselves, but also friends and family members of the individuals to get trained and obtain naloxone, typically Narcan, which is the nasal version of naloxone, because we want those people to have it on hand as well, so that if they're with that individual and they happen to experience an overdose, they understand exactly how to administer it and hopefully save that loved one's life. Our website has a lot of information around how to get trained, how to obtain naloxone or Narcan, and also the steps that come along with it. So how to put somebody into the recovery position, and how to do rescue breathing as well. And then just the last thing I'll say is that all drug overdoses are medical emergencies. So individuals should always call 911 if they think someone is experiencing an overdose. If you believe it might be an opioid overdose, please do administer a form of naloxone if you have it. It cannot, even if it's not an opioid overdose, the naloxone will not harm the individual. And then again, if you're familiar with those steps in putting somebody in the recovery position, doing rescue breathing, what to do in the meantime, that'll help keep the person alive until first responders arrive.
Okay, wow, that's a really good information to know. It's really good information for our community to know right now, especially in the 53215 zip code. So what resources does the state provide for drug addiction right now?
So a couple things that I want to mention right off the top is we do sponsor and fund the Wisconsin Addiction Recovery Helpline. There are 4 ways to access the helpline. You can access this obviously by calling it, but you can also go onto the website and access it. There is a chat option and also a texting option. And the Wisconsin Addiction Recovery Helpline has been in operation for about 2 years now, and we identified this as a need because we heard many stories from around the state about how individuals would just Google for a helpline or call their insurance company and ask for referrals to either treatment or other services. And many times they would be referred to services that were, out of state or maybe on the other side of the state. And that's not really helpful to somebody who is seeking care right then and there. We want to be able to support them at that moment and connect them to those services. So what the helpline does is it connects them to those services that are local to them. So if I'm in Milwaukee and I call the helpline, I'm going to be connected to services in Milwaukee. Hopefully, even if it's in one of the suburban communities of Milwaukee County, hopefully you're going to get connected to services actually in that community. But if not, at least local to you in Milwaukee. And we know how important that is because people don't have readily available access. They're less likely to actually follow through on that. The other thing is the Resilient Wisconsin campaign that we started during the pandemic. And this goes back to what I was talking about before about finding those safe and healthy coping skills for individuals that are so needed right now. So our website, check out Resilient Wisconsin, and this connects you to other hotlines as well as those virtual support meetings that I mentioned. And just a lot of other different care and services that are available to people. So in general, though, we at the state, we're working to increase the access and availability to prevention, treatment, and recovery services statewide. Specifically in the treatment area, we've really put a lot of work and effort into expanding access to medication-assisted treatment, which is the gold standard evidence-based form of treatment for opioid use disorder. So making sure that individuals have access to this and again know how to access it has really been a goal of the department. And of course, we work with our counties, our tribes, all of our other partnering organizations and agencies that are those boots on the ground that are implementing whatever the type of service or care is that's needed to really try and continue to increase the level that is available around the state.
Right. Thank you for all that information. We have some comments here, some questions from people. So first question is from Brea. She's asking, what is the state doing to increase the amount of beds for rehab and treatment, especially for low income or homeless residents?
Yeah, really good question. So, no matter if we're talking about opioids or just any type of substance use disorder across the board, there are those social determinants that are so important, and we need to be able to support individuals with to support their recovery and hopefully be more successful in that road to recovery. And housing is a huge issue. Housing is a really big issue that we're trying to do more to address. So a couple of things I can just list very quickly off the top of my head is one, right now there for Medicaid, there is no benefit for residential SUD treatment. It's something that the department is working on, has been working on for close to a year now, really been engaging partners to make sure that we are getting it right. And that'll be very helpful once that benefit is available, which we hope is by the first of the year, so that individuals can get that level of care that they need, that residential level of care. The other thing that we are in the process of doing right now is we're putting together a recovery residence registry. So this will be a registry that's available on the DHS website for all recovery homes, sober living facilities, anything that kind of falls in that realm, so that individuals will have much easier access to contacting those places. And then the last thing I'll say is that we're whenever possible, providing partners with funding that can not only support the treatment that is needed, but support these other things like housing, like employment, training or services that are needed, so that individuals are getting the help in that area at the same time they're receiving the treatment services.
Right. Yeah. I'm really glad that the state is currently working on trying to get the in-housing treatment resident facilities for individuals, because I would say a majority of the homeless individuals in the entire United States, not just Milwaukee and Wisconsin, it's all about, it all stems from mental health issues or, a drug addiction problem. It's just a cycle. It's all connected. And yeah, and if you are a drug user, then, you have a less likely chance of maintaining and holding a job, and you become homeless. So it's all like a systematic circle that turns and turns. And that's one thing that I think really needs to be implemented, is a better way to, understand mental health and, take individuals that do have a drug addiction problem into, residential facilities, so then they can get full treatment and it's fully funded, and, then they'll come out clean. And
yeah, you make a really good point. And what we're really trying to focus on and create ways to do is treat the whole person. Because exactly what you're saying, we know if we're just treating the substance use disorder and not addressing any mental or behavioral health issues as well, we're not gonna be as successful as we could be. We have to treat the whole person, the whole individual. So how do we ensure that they're getting the treatment for their substance use disorder, as well as that behavioral health care that might be needed, as well as supporting them with all those other kind of areas or social determinants that we know are so important, which you mentioned, and like I mentioned before as well too. So I agree with you 100%, and that's really what we're trying to focus on.
Right. That's awesome. That's really great news to hear. And you said, and hopefully in the next year, it should be something that we can look forward to.
Hopefully, yes. And we got some other initiatives in the hopper as well that we're hoping to really roll out within the next year.
That's great. So we have two more comments for you. Sorry, I went a little bit over time, but
that's okay.
So Drea also said, so proud my dad is 5 years clean. Horrible battle that wrecked most of my childhood. Yeah, it can definitely be, again, like you said, opioid and drug, addictions don't just affect the individual themselves. They affect the entire, like a family. They affect society. They affect the community, so it's all connected. It can,
I'll just say, Drea, thank you for sharing, and I'm happy to hear that he's doing well. But unfortunately, there's a real stigma that still exists around substance use, and sharing stories like that is actually really helpful, because it puts a face and a story to recovery, and shows people that recovery is possible. And I just think that's really helpful. And also the other thing I'll say is that I believe the first part of or somewhere in your statement there was that your childhood was wrecked, and obviously I'm extremely sorry to hear that. There are no words that I can really say to deal with what you dealt with and the impact, but that's something that people don't think about a lot too, is what is the direct impact that's being had on individuals' family members or friends. And we really need to focus more on that, I believe, and think about how can we be supporting those that aren't struggling with substance use but are impacted by their family member or by their friends or their relatives that are struggling, and so those individuals, they need they need help too. They need, that self-care that's so important. And they might need some type of counseling or therapy support services as well to deal with what they've had to see and endure when their loved one has been struggling with substance use. So I just wanted to mention that as well. But thank you for sharing your story, and I'm glad he's doing well.
Yeah, thank you for sharing, Andrea. And then one more question. Gabe is asking, where can someone get Narcan to be prepared in case of an overdose?
Yeah, great question. So like I mentioned, we're trying to do we're trying to implement as many strategies as possible so that people can obtain Narcan. And so my number one recommendation would be go to our website, and it'll list them all. The DHS website, if you go to then look at opioids, and then look at on the pages for naloxone or opioid reversal drugs. But some that I'll mention real quick is that we do have a project called Narcan Direct, where we contract with local public health departments, syringe access service agencies, community recovery organizations, and they provide training to anybody in their communities that wants on Narcan. And then after the training, you are actually given a 2-dose kit of Narcan for free of charge. That obviously has been unfortunately scaled back, a little bit during the pandemic, but they are still happening. I do know that we partner with several organizations in Milwaukee County. So I would encourage you to look again at our webpage, and then you can contact those groups and see when you might be available to get trained and access Narcan. The other thing I'll mention is that the state of Wisconsin has a statewide standing order for naloxone. What this means is that even though it's a controlled substance, you do not need a doctor's prescription to obtain it from a pharmacy. Our chief medical officer at our department signed the standing order. So again, if you go to our website, you can look at participating pharmacies across the state. I believe we're around 400 participating pharmacies now statewide. There are definitely plenty in the Milwaukee and southeastern Wisconsin area. And so anybody, and literally anybody, can go to one of these pharmacies and ask for Narcan. And then the only difference with this is that it does not cover the cost. So you will have to pay, again, whatever your insurance is. Whatever the coverage is. So I will just say, it could be $5, but I do know that there are cases where it could be like $100. Mm-hmm. So it's different depending on, again, what your insurance coverage and type is. But those are just a couple ways that you can literally go out and in the case of the standing order, get it today if you really wanted it and needed it.
Oh, wow. Okay. Thank you for that information. And I will definitely look through the website and make a Facebook page post on our SOC Facebook page, so then everyone can have access to all of this information. Like the opioid overdose hotline and all of the different resources that Paul has just mentioned today. We do have the DHS website in our comments, so if you'd like to click on that, you can go right to the opioid page for the Wisconsin Department of Health, and you can check out all the different resources that they have available that Mr. Krupski has already mentioned. Well, I feel that is all that we have for today. Did you want to add anything onto this? Any closing statements?
I'll just say that, thank you again for having me. It's really important to get the message out and to talk to people and let them know what's happening in the state and what's out there for them if they need it. And I will just say that, we were seeing some real positive downward trends in overdoses and deaths leading up to the pandemic in our state, which we were really excited about at that point. But unfortunately, it is increasing now, and we need to bring awareness to that. And we're doing all we can to address it. But so just thank you again for having me, and really please don't hesitate to reach out to the department or myself if you have any questions, comments, concerns. On the website, there is a link directly to my email, so you can reach me that way.
Awesome. Thank you so much, Paul. Definitely, we would love to even have you on again, maybe to talk about stigma and addiction and break that down. Definitely a great topic, really important information that many individuals just don't know about. They're not aware of even the basics of opioids, so it's really good to get that out there. I just want to say thank you again, and it was a pleasure having you on.
Thanks so much. Appreciate it.
Thank you. All right. Thank you, everyone. Thanks again to the Wisconsin Department of Health and Paul Krupski for coming on and being a guest on the forum. Always great to have leaders of the state and the city to talk about these important topics. So now I'm going to see if we have any other hellos or questions that were given out. Hello from Charlie. Let's see. I do not see any other hellos or questions, so we'll move on to the next segment. So now I'm going to give you a quick video on coronavirus. Thank you. That was a video created in partnership with the 16th Street Clinic. We are campaigning for COVID-19 and COVID-19 CDC regulations during this time. So just a reminder to wear your masks at all times and wash your reusable masks as often as you can to eliminate the increase of bacteria in your mask and decrease COVID-19 within Milwaukee, especially the 53215 and 53204 zip codes. So now I'm going to give you a quick video on CIVIC.
Mailman's here.
Okay, Grandma. Well, looks like it's time to vote.
Vote? With all this COVID going around, is it safe?
Of course it is. Now that we can vote by mail, we don't have to choose between our right to vote and our health. Plus, we can do it right from home.
Really? I never heard of that.
Absolutely. It's safe and secure.
Are you sure? This whole thing makes me nervous. Let me ask you this. What if my vote doesn't get counted?
I get it. I was a little nervous the first time I tried it too. Voting by mail is safe and secure. I've been doing this for a few years now without any issues. As a matter of fact, several states run their entire elections by mail-in ballots. It's always been secure. Honestly, it couldn't be better timing. Now that we're dealing with COVID-19, I think you should really consider this. I think it's so important that we vote, but I'm really concerned for your safety, especially with your asthma.
Okay, let's do it. In fact, I remember the first time I voted, I was wearing that exact hat.
Okay, Grandma, that's sharp. Just like you.
I loved that video so much. Definitely go out there and vote. Your vote will be counted. And Just get your absentee ballot so then you feel safe while you're voting and your vote does count. Now we're going to move on to our census segment.
Hey everybody, so I just want to give you an update on census response rates on the South Side. So the two areas that are orange and bordered by black on this image are the only two areas on the South Side where there is still less than 40% of households that have responded to the census. So what does that mean? That means that we have right now until October 5th to encourage people that we know that live in these areas to get counted in the census. And we always share the link that you can use to fill out the census in our comment section. So send that link to some friends or family you know that live in these areas. The top square is between Scott and Lapham Street, and then between 9th and 16th Street. And then this bottom square is Beecher to Lincoln between 16th and Muskego Avenue. So please, if you know anyone that lives in this area, make sure that they are counting themselves in the census. We only have until October 5th. We were hopeful that the original deadline of October 31st was going to be restored, but it's looking like the Census Bureau is going to be ending their operations now on October 5th. So as of now, we only have these next few days to be filling out the census. So please encourage anyone you know that lives in these areas and anywhere in the South Side, anywhere in the city, to be filling out the census.
Thank you, Gabe, for that update. Now we're going to move forward to our SOC feature. So for our SOC feature, we have Melinda Hughes from the Benedict Center, and with her is one of our coworkers, Andrea.
Hello, my name is Andrea Rodriguez, and I'm the Leadership Coordinator for Southside Organizing Center. Today, I'm joined by Melinda Hughes, Program Director for the Sisters Diversion Program at the Benedict Center. Thank you, Melinda, for joining us today.
Pleasure to be here.
Excellent. Melinda's going to cover with us some of the 10 areas of emphasis that they use at the Benedict Center and the diversion program, so I'll let you go ahead.
Yeah, thank you. We do have sort of an outline of the areas that we try to help our clients work within and work with, depending on their interests and their needs, obviously. And, you know, we have up here on the slide as well, Maslow's hierarchy of needs, just to help the viewing audience understand, like, why do we focus in the areas that we do, right? So if you look at that triangle and start at the bottom, the physiological needs that a person might have are things like food and water and shelter and warmth. And, you know, we lump all that under the category of basic needs. We do a lot of work in the basic needs area. So I'm just going to back up to our different types of methods of connecting and support. So you'll see it on that slide, a lot of activities, both in our outreach team and our drop-in centers, that are focused around food needs, clothes, hygiene, you know, connection, all of those basic needs that any human being needs in their life. And then when we move up the triangle a little bit, then we get into things like safety and employment and assets. And so we would really say that safety for our clients is a number one need. It's actually as important as all the basic needs, because they do, unfortunately, because they're experiencing a lot of violence directed at them. They, you know, may have come from already abusive home life, but certainly given that about 50% of our clients are homeless or you know, precariously housed, they're experiencing a lot of violence anyway where they're living, and, you know, in doing the work that they do in sex trade work. They're doing sex trade work to survive, and unfortunately it puts them in a vulnerable situation to be exploited, coerced, and or victimized and brutalized out on the street. So it's one of the reasons, and from feedback from our clients, that we've been making housing such a number one priority in a housing first initiative, working with our partners at the housing division and with Impact 211, and really trying to make sure that each person has a safe place to live. I mean, that's kind of priority, right? Like if you think about, in order to work on all of these other things that we might need to work on, first and foremost, we have to have a safe place to be, and like a roof over our heads, and access to food and water. But food, water, shelter are key, and it's hard to have safety without those elements in place. So that's where we start, and that's our first level of working with folks to help stabilize their lives and make them safer. And then once somebody's in that circumstance, then they can work on other things, like trying to figure out a job situation, or go back to school, or reconnect with friends and family.
As we're wrapping up right now, you also mentioned to me earlier that there are some hour changes at the center.
Yes, as we go into fall and winter, we are going to be changing our hours just a little bit, and we're going to be on our South Side Drop-In Center, which is at Hope House. We are going to be from 9 to 12, Monday through Thursday. And then in our North Side Drop-In Center, we are going to be doing 1 to 4. So basically morning on the South Side and afternoons on the North Side. And our outreach team will continue to work and travel the North and South Sides each day.
In our last few seconds together, can you just let us know any final calls to action that you have for viewers?
Yeah, it's starting to get cold at night, so we are collecting donations of warm shoes or boots and jackets, gloves, starting to get to winter in Wisconsin, so we're preparing and trying to get those warmer clothes into ladies' hands.
Excellent. Thank you so much, Melinda. We look forward to having you on the forum again.
Thank you so much, Andrea and Melinda. Really important information. That reminds me, I'm going to go look through all of my old coats and winter wear and donate it. And everybody else should also do the same. So now that that's said, I'd like to give you guys our SOC survey promo that is facilitated by our producer, Marisol.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.
Thank you, Marisol. So some quick reminders. Tomorrow we're having Dr. Joseph, Dr. Baez, and Jennifer Morales coming on from, they've all been and are current individuals that have contributed to the MPS school board. So they're going to be talking about the MPS school system right now and what's going on with that. And then our SOC solidarity goes out for protesters and their families that have been impacted. And our thoughts and prayers go out to those that have been impacted by COVID-19 and family members or friends that have passed away from COVID-19. Our prayers and thoughts go out to you. And I hope everyone has a great rest of their day. Please come on the forum tomorrow to watch our show. And I'm going to leave you with some funder partner thank yous.
Hello, viewers. I am Esperanza Gutierrez, a longtime resident of the near South Side. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our SOC survey. In addition to thanking our residents for tuning in and sharing our show, we would also like to thank the following sponsors: Wisconsin Voices, Community Development Block Grant, Neo Philanthropy State Infrastructural Fund, the Movement Voter Project, the Catholic Campaign for Human Development, the Silber Foundation, City of Milwaukee Office of Violence Prevention, the Tithe Foundation, the City of Milwaukee Promise Zone, and all the faithful individuals who support SOC through their personal donations. Thank you. Gracias.